Now, you may have heard the word gout, but do you really know what it is? Well, for National Gout Awareness Day today, we are talking with Dr. Brian Mandell and retired football player Anthony Spice Adams, who actually suffers from gout. Gentlemen, you are going to help us learn more about this extremely painful form of inflammatory arthritis and also what could possibly put us at risk. So thank you both so much for joining us.
Thanks for having us.
Doctor, let's start with just the obvious question. What is gout?
So most people, when they think about gout, they think about the attacks of gout, the sudden red-hot swollen ankle or foot or toe that just comes out of the blue and is incredibly painful. But what gout really is all about is it's really a chronic disease. Uric acid, which is a chemical that we all have in our bodies make it, we get some from food, is in our bloodstream, and if you have a level that's too high, it settles out of the bloodstream and coats the lining of the joints and tendons. When that happens, you can picture it like icing on a cake. That's exactly what it looks like. That sometimes that icing kind of breaks off and you get crystals of gout that come off into the joint space and set up that acute, incredibly painful attack of gout. So gout is not only acute episodes, it really is a chronic disease which requires management to lower the blood levels of uric acid to make those attacks finally stop.
Well, you mentioned a little bit about those uric acid levels. What is really a healthy level for a person to have?
Well, the healthy level is probably below the level of which the uric acid settles out. It settles out around 6.8, but if you have gout, our target level, where we'd like all patients to be, is below 6. And the rationale for that is if the level stays below 6 and you have gout, that'll actually stop the uric acid from depositing in the joints, and in fact will make the uric acid go the other way. It'll let the deposits, the icing on the joints, actually dissolve. So below 6 is where somebody with gout would want to be if you want those attacks to stop.
Well, and Anthony, how is it that you received your diagnosis?
Well, the first time I got a gout flare-up was in 2005. I was 25 years old. I was with the San Francisco 49ers, and we just had a game on Sunday. Monday and Tuesday passed. Wednesday, when I wake up, I feel this excruciating pain in my knee, and I'm unable to bend it. And I go to the training facility, and they say that I have a stress fracture. So fast forward 4 years after that, 2009, when I became diagnosed, they said, "We think you have gout." And I just couldn't wrap it around my head. It was mind-boggling to me that, you know, I'm 29 years old and you're telling me that I have gout. My granddad had gout, but he was 75, so I'm thinking I got at least 50 more years before I'm affected by it. So make a long story short, we go to the rheumatologist, and they do some blood work, and he comes back and he says, "You indeed have gout." And so from that point on, I started to educate myself on gout. And so I went to websites like gouteducation.org, and I found out about this campaign that we're doing now called Go for 6, where they want you to check with your physician every 6 months and see about your uric acid levels and keep your uric acid levels below 6 milligrams per deciliter.
Well, I think that's such a good point that you're making for everyone, is that you thought, you know, you have a good 50 years before you may have to deal with this, but this is something that can really affect a lot of people. So I'm so happy we're getting your first person account, Anthony. Thank you so much for, you know, coming and telling us about that. Now, doctor, how are we spreading education or how we can prevent these flare-ups?
Well, the best way to prevent flare-ups, if you once you've had one, is really to lower the uric acid level in your blood. Diet will help some, limiting amount of red meat, limiting the amount of beer and alcohol, all of that will help. But the main thing is get appropriate diagnosis, treatment, which is often medication, and keep that level below 6. Source for education, Gout, G-O-U-T, gouteducation.org will provide a whole lot of information for patients as well as their physicians.
I think that's great information and great advice. Gentlemen, again, I can't thank you enough for the information, and Anthony, for telling us about your personal story.
No problem.
Thanks.
Thank you so much. Don't go anywhere. The Morning Blend will be right back.